Now we're going to talk a little bit about when it's time to call your provider during labor. The first thing to remember is that all providers have different guidelines about this, so you'll definitely want to talk to your provider during your pregnancy and find out what their guidelines are. For example, here in Chicago, there's providers that want women to come in when their contractions are 5 minutes apart, or 3 minutes apart, or 4 minutes apart, so just kind of getting a feel for what they're looking for is important. But in terms of deciding when to go, definitely you're going to want to be timing contractions. So you'll time contractions from the beginning of one contraction to the beginning of the next one, and that is the time in between. And then you're also going to want to be looking at how long the contractions are. So usually in active labor, we expect that contractions will be about 60 seconds or 1 minute long. And then because we know that labor can kind of change from basically moment to moment, we'll want to know that your contractions have been a certain way for a certain amount of time, usually before your provider would advise you to come in. So for example, in early labor, sometimes you might have contractions that are only 3 minutes apart, but then maybe the next one is 8 or 10 minutes apart. So we want to know that your contractions have been consistently close, usually for at least an hour before you would go into the hospital. So if all we're looking at is timing of contractions, usually providers will say to follow the 5-1-1 rule, which means contractions 5 minutes apart, at least a minute long for at least an hour. Some providers will use the 4-1-1 or the 3-1-1, which is basically the same thing, just contractions 4 minutes apart or 3 minutes apart instead of 5 minutes apart. Other reasons to go into the hospital or to call your provider would be, if you started having regular contractions, so more than 5 or 6 contractions in an hour, and your baby was not term, meaning your baby was earlier than 37 weeks, preterm labor can progress really quickly, and because there's things that your provider can do to stop it, you want to contact them as soon as possible. And also, of course, if your baby was going to be born early, you definitely want to make it to the hospital for that. Other reasons to call would be if your water broke, especially if you notice that it broke and it either had an unusual smell or an unusual color. So an unusual smell may indicate an infection, an unusual color could indicate that there's meconium in it, and that would be kind of a greenish brownish tinge to the bag of water. But all of this really, again, you need to discuss with your provider and just kind of find out what their policies are so that you know exactly when to call.